We've partnered up with Dr. Mehmet Oz for a closer look at some big health issues facing men. This morning, we're focusing on prostate cancer and the debate over screening and treatments. Take a look.
Hi, I'm Clark Howard.
For nearly a decade, Clark Howard has been living with prostate cancer.
It's time for
This radio DJ from Atlanta consulted with his doctor and decided on using what's called active monitoring. That means that because his cancer is slow growing, he opted to monitor it closely rather than have surgery or radiation. The prostate is a walnut-sized reproductive gland found only in men. More than 180,000 American men will be diagnosed with prostate cancer this year. More than 26,000 will die from the disease. Besides a rectal exam by your doctor, historically the only screening for prostate cancer is a prostate-specific antigen test, usually known as a PSA test. It's a simple blood test that measures a specific protein produced by the prostate. If the PSA level is elevated, it could indicate the patient has prostate cancer. Active director Ben Stiller recently credited a PSA screening with saving his life.
I learned that, I was someone who had, a case that could be treated. There are a lot of people who can't.
Because it's too late.
Because they discover it too late.
I mean, you got very lucky.
Yeah. And
in Stiller's case, he says his doctor watched his PSA level rise over a year and a half before sending him on for further testing. Ultimately, he had surgery to remove the cancer and says he is now cancer-free, but treatments vary. A landmark study published in the New England Journal of Medicine followed more than 1,600 men with diagnosed prostate cancer. The men fell into three groups: those who had surgery, those who had radiotherapy, and those who actively monitored their cancer. After 10 years, researchers found almost no difference in death rates between the groups.
This study shows that there were serious side effects of treatment in terms of sexual, bowel, and urinary function, but there were side effects in the men who were on active surveillance too, because the risk is the tumor will grow.
For Clark, active monitoring was the right choice.
that I'm sitting there just watching it drives people crazy. But I think I'm crazy like a fox. I think what I've done is the right thing to do.
Dr. Oz joins us now live in the studio. Good to see you. I was shocked by the numbers. Over 180,000 cases will be diagnosed this year. 26,000 men will die of it. This needs attention.
Most common cancer, and men are confused. In our big survey we did together, we saw that 54% of men don't know what a PSA test is. 61% want the test. So as our pollster Mike Brolin said, they're in the dark. They don't even know what it is, and they want it. And the confusion is in part caused because people don't understand, even in the medical community, how powerful this test is, and maybe it shouldn't be.
Oh, okay, so what's your recommendation? Who should get the PSA exam? And at what age should they start?
So the reason the U.S. government and major medical groups don't get along on this is because people think you'll overtreat the PSA. So if you're thoughtful about it, you don't get rushed into doing procedures on yourself, then a PSA test in a middle-aged man, I think, makes sense. Many medical groups agree with that stance. But if you're African American or if you have family history that makes you at higher risk, you really should think about it. But here's the thing, Matt, big issue. Most men think the PSA test will tell you if you've got aggressive cancer or some type of cancer. Not true. In fact, 75% of the time, it's going to be a false positive. So don't get biopsy, don't get aggressively treated because the PSA test doesn't tell you that.
Okay, so that's a really good thing. You're in a doctor's office. The doctor walks in and says, Mr. Lauer, I have bad news. You have a PSA of X level. You have prostate cancer. What is the first thing you want men to do or not do?
Let me blow your mind with this. That's the data set from the survey we did together. 79% of men think that if they have prostate cancer and don't have surgery, they will die. That is completely wrong. That is not what happens at all. In fact, this is changing the whole paradigm of how we manage all cancers. Most men, as you saw Clark, our DJ, with active surveillance don't seem to pay a penalty. In fact, even lifestyle change seems to make a difference for prostate cancer management. So don't think of it as something you have to get out of your body immediately. Ben Stiller very wisely waited 18 months before he went ahead more aggressively. Men, I think, should have the information because it's power in their hands of this PSA test, but do not get roped into getting biopsies or other invasive procedures. Active monitoring, I'm telling you, paying attention to yourself is probably the better way to go.
All right, Doc. Thanks very much. We appreciate it.
Hello, Today fans. Thanks for checking out our YouTube channel. Subscribe by clicking that button down there and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives.